It begins with sophisticated computer models that predict where and how quickly the virus will spread. The purpose of these predictions is to, as you know, flatten the curve. Not necessarily to lower the death rate, we haven't been able to do that much, but to slow the spread of the pandemic over a longer period of time. Why? Because if everyone were to get sick at once, our healthcare system would collapse, and that would leave coronavirus patients and many other sick people without care, and that would be a disaster. So we're trying hard to prevent it, and we should. But it means these predictions really matter. How reliable have they been? Well, many government policymakers have relied on a model created by the Institute for Health Metrics and Evaluation, the IHME. By some measures, like death rates, that model has been fairly accurate. Yesterday, for example, the model predicted 1,036 deaths nationwide, and that turned out to be close to what happened. Today, it predicts about 1,200, and judging by the numbers right now, at 8:14 Eastern Time, that should be roughly accurate too. But on other, likely more important numbers, these predictions have been terrible at best. As of yesterday, the IHME model predicted the country would need 135,000 hospital beds just to treat coronavirus patients. That's what they said. New York alone, the model predicted, would need 56,000. That turned out to be not even close. Yesterday, New York was at about 13,400 coronavirus hospitalizations. That's not even a quarter of what the model predicted. And even that was closer than what the model foresaw in other states. For example, the model predicted Oklahoma would need 1,000 hospital beds. How many are they using now? 38. Louisiana was forecast to need 5,800 beds. Instead, yesterday, the state had about 1,600 hospitalizations, just a small fraction, and so on and so on. Nationwide, just 3 states had more hospitalizations than the model predicted. And in all 3 of those, they were small states with very small outbreaks so far. So why does this matter? Here's the problem with getting these numbers so horribly wrong. These numbers have driven massively disruptive government policy. Our entire national shutdown is based on the fear that coronavirus patients would overwhelm hospitals. And outside of parts of New York City, that has not happened. And we're glad for that. But we're concerned about what we've done to prevent it on the basis of models that have been wrong. So flip it on its head. What would have happened if the model had been accurate, if it had accurately predicted how many hospital beds we needed? If we'd known that, would we have quarantined the country? That's a good question. Unfortunately, it's too late now. More than 10 million Americans have already lost their jobs. Imagine another year of this. That would be national suicide. And yet, that's what Anthony Fauci is suggesting, at least. Now, we're not suggesting Fauci wants to hurt America. We don't think he does. He seems like a very decent man. But Fauci is not an economist, or for that matter, someone who fears being unemployed himself. Like most of the people around him, this is not an attack, just an observation. Fauci has bulletproof job security. He's not thinking that way. He has the luxury of looking at the world through the narrow lens of his profession. He doesn't seem to think much outside that lens. Watch this exchange from NBC's morning show yesterday.
I know it's difficult, that we're having a lot of suffering, a lot of death. This is inconvenient from an economic and a personal standpoint, but we just have to do it.
Inconvenient? 10 million Americans out of work and staring at poverty. That is not, quote, inconvenient, as you just heard Dr. Fauci put it. It's horrifying. In fact, it's a far bigger disaster than the virus itself, by any measure. Tony Fauci, decent as he may be, can't see that because he doesn't think it's his job to see it. But even a doctor should be able to think beyond the models. Our response to coronavirus could turn this into a far poorer nation. Poor countries are unhealthy countries, always and everywhere. In poor countries, people die of treatable diseases. In poor countries, people are far more vulnerable to obscure viruses like the one we're fighting now. You want to keep Americans from dying before their time? Then don't impoverish them. For all his credentials, his experience, his apparent personal decency, Dr. Anthony Fauci does not seem to understand any of this, and we should never let someone like that run this country. Brett Baer is our chief political anchor and host